colleague and friend Minister, President, ladies and gentlemen, I'm honored to be here today with you at this very important session which demonstrates how committed the Greek government is to broadband as a policy flagship. And I fully share this goal, because broadband is critical if we want to boost the competitiveness and the growth of Europe and of its member states. As we have already heard today, the penetration of broadband lines is increasing fast in Greece. In January 2007, there were 4.4 active broadband lines per 100 citizens. I have heard that this number has dramatically gone up. However, even if it goes up, it is far away from the European average of 17% and is even further away from our best players, around 30%. Despite the significant increase in recent months and government initiatives such as the Year of Broadband, Greece is still trailing in last position in the recently enlarged Europe of 27 member states. And not only that, it's also a question of speed, because the speed of those broadband connections here in Greece is very below what many other European consumers are used to. Second, let's look at the coverage of broadband lines. Here, Greece is again at the last position. Only 19% of Greek citizens could subscribe, if they would like so, to broadband, compared to nearly 90% across Europe as a whole. Now, I do recognize the topography of Greece, which doesn't help. All those beautiful islands, these beautiful remote mountains, but at present, the broadband availability is not only a dream in the mountains and in the villages, it is even a dream for the citizens living in suburban and rural areas. Now, sometimes I am asked by the Greek citizens, why to bother? Why is broadband important? Why should we care? What is it that I claim that Greece needs broadband and that it needs it now? So let us look what Greece is missing out because it lacks broadband. There is growing evidence that broadband boosts economic growth. An MIT study published last year showed that broadband boosts the employment by almost 1.5% per year. As well, there are significant increases in the setting up of new firms, mostly in the field of knowledge economy. The Scottish executive has recently estimated that Scotland's private sector will grow by 10 billion euro up to 2015 due to broadband uptake. And a recent OECD study shows that firms that adopt e-business techniques using broadband can raise productivity by up to 31%. Now, the lessons are very clear. Broadband makes good economic sense for the business community, and the more intensively you use the more the productivity gains you will make. That is one, but only one reason why Greece needs broadband and why it needs it now. Speaking about public services, some say Greek citizens simply are not interested in fast internet access. Well, especially as citizens, Greeks should be interested, and they should be calling on their government to set the lead, because broadband means better, more efficient, more effective services for citizens. Citizens who can be online instead of standing in line. And the fact that Greece has a special, wonderful geography of mountains and islands makes this even more important. Let me give you the example of healthcare. Broadband means bringing the best standards of care to the remotest locations. It can offer life-saving clinical applications, such as remote surgery, remote diagnostics. Imagine you have a heart complaint and you are away on your island retreat. Can you afford to wait until you are back in the city if you feel chest pains coming up? Perhaps the local doctor will be able to help, but will he have access to your history of electrocardiogram to see if you have suffered a new attack? Will he know or have access to all your treatment records? Suppose there is something wrong and you need treatment in a local hospital. Would you not feel better if your cardio specialist could sit on the intervention online? Now, this might seem an exceptional case, but it is not. Clinical e-health application mean faster and more accurate treatments, reduced cost from referrals. Remote treatment means access to top specialists, local treatment of minor surgeries and effective treatment of trauma, where time delays and risks are extremely important. Remote monitoring means that people can go home earlier after treatment, or it allows people to stay in their communities even if they have a delicate medical condition. And this is very important for our elderly society, and you know that we are aging in our societies. Remote consultation means patients don't have always to travel long distances to see specialists. Training and diagnosis support can increase certainty for doctors and patients. Electronic health systems can reduce errors in prescriptions, improve the coordination of multidisciplinary care needs, avoid expenses and necessary duplicate tests, get results to doctors more quickly, facilitate electronic prescription at the pharmacist, and reduce risk of mistreatment. Remember, there are more people dying in Europe each year by medical errors than there are killed in traffic accidents. And we can avoid that by new technology. Well, the list could go on. And I hope you are by now convinced of the potential benefits. And in this context, I would like to applaud the Hygienat in Crete as an example of how health networks can be put into practice. But there are many factors that hold us back. Administrative factors, budgets, uncertainty about how to handle reimbursement for treatment. Technical factors, especially the lack of interoperability of systems. Human factors, especially resistance to change from healthcare professionals, from administrations. The latest survey data from the Observatory on the Greek Information Society indicates that still around 1/2 of the doctors are only on internet. Only 1/4 keep patient records electronically, and only 1/3 of general practitioners are online, broadband online. On the other hand, 83% of doctors that have taken up ICT say it adds considerably value to their work. Now, why those delays? What is a problem? Our studies show that unless doctors, nurses, and pharmacists have systems that give them the information they need instantly, they will not use e-health services. If they do not have access to fast, always-on communication, they will not take up those life-saving, budget-reducing, care-enhancing services. And that is why you need to go beyond the stage of pilot programs. Greece needs a fully operational knowledge web for healthcare based on a developed broadband